I welcome members and viewers who may be watching our proceedings on Oireachtas TV to this meeting of the Oireachtas Joint Committee on key issues affecting the traveller community. And the purpose of today's meeting of the Joint Committee is to start our deliberations on the topic of employment. And this is our first hearing of four examining the disproportionate levels of unemployment among travellers by this committee. Listening to presenters from the traveller community and others, we hope to get a sense of the scale of the problems facing travellers in accessing jobs and how to remove those barriers to employment. Since we started our public work in September, this Joint Committee has become aware in terms of the key issues affecting and bearing down on travellers. And these issues, of course, are not standalone, they're very much connected. So the members of the committee know that travellers are 7 times more likely to take their own life. According to the Irish Traveller Movement, an estimated 30 people died by suicide up to the end of August this year, including children, and a trend is emerging among young mothers as well in that regard. The Minister for State for Mental Health, Jim Daly, admitted that there is a crisis in mental care among travellers. The members of this committee also know that there are gross disparities in general health for travellers and the general population, that if you are a baby born to a traveller family, your infant mortality is almost 4 times higher than the general population. A traveller baby is 4 times likely, therefore, more likely to die than a baby in the cot next to him or her in the hospital if he or she is a non-traveller. Travellers die young, and 70% of travellers fail to reach their 60th birthday. The committee knows that there are 50 times more likely to travellers are 50 times more likely to leave school without a leaving cert. Travellers are disproportionately affected by the practice of reduced hours timetables, where their culture and history is neither taught, understood, nor respected, and when children and young people not so much drop out, but are pushed out of education. And we had 2 education ministers here last week acknowledging the issues and willing to consider this committee's recommendations. Poor education attainment among travellers, of course, has knock-on effects to employment, which is what we're talking about today. And this is what we are examining. And the statistics here are stark. We know from the CSO 2016 census that 80% of travellers within the potential workforce are unemployed, 80%, as opposed to 13% in the general population. 1.1% of travellers are self-employed, compared to 16.6% of the wider community, and self-employment was such a big source of employment for travellers in the past. From the ESRI, a social portrait of travellers, the employment rate of non-travellers is about 6 times higher than that of travellers. So again, whatever way you slice and dice the statistics, the disparities are vast. Comparatively, nationally, the traveller employment rate is just 9% among those with primary level education, 15% for those with lower second level education, which is the junior cert, 27% for those with leaving cert, and 57% for the very small number of people with further or higher education, compared to 85% of the wider community. And again, from the National Traveller Survey, of the 60% of travellers who participate in a trainee scheme, only 3 in 10 went on to get a job. 43% of travellers said they experienced discrimination when accessing employment, and only 1 in 10 of non-traveller employers, 1 in 10, said they would employ a traveller. So that's prejudice and discrimination on a pretty grand scale. So this topic is very important, and obviously there's huge tracks back to education, health and mental health as well. The off-the-scale rates of unemployment is a waste of people's potential and affects people's health, mental health and life chances. Such disparities merit a major investigation at a time of full employment and skills shortages, so we hope to make that start today. And so I welcome Mr Patrick Riley of Pavey Point. You're very welcome. You're back again, telling your story. We hope that the story is going to lead to action, Patrick, because I am conscious of the effort and energy that so many people like yourself, and indeed Kathleen Sherlock and TJ Horgan from Mincar Widden are regular visitors telling a story about key issues affecting travellers. Dr Mary Murphy, Ms Sinead Burke and Ms Orla O'Neill from the St Stephen's Green Trust, you're very welcome. And Mr James O'Leary, Director of Involve, Mr Michael Power, the Editor of the Traveller Voice magazine, and Dr Sheila Cannon, who's the Director of ShuttleKnit. So we have a lot of people to hear from. So I now ask, thank you very much. It's been a really interesting couple of hours. We could spend even more time, and we are going to be spending 3 more modules on this. I mean, given that there is 80% of an unemployment rate, which is kind of, you know, it's beyond shocking, really. And when you say it's shocking, it almost like is banal and trivialises it. We have no choice but not to leave travellers where they are, as you put so eloquently, Patrick. The Pathways to Work review is obviously a clear opportunity, and travellers need to be there, but in a meaningful way, with programmes that would actually work for them. We need targeted, we need generic, we need a range of interventions. We need mainstream access, but we also need specialised and specific. We need the whole gamut if we are to tackle that rate of 80% unemployment. Quotas, and hearing you about quotas, but only in consultation with the traveller community. Internships paid, but they have to be meaningful. They're not just a box that's being ticked. Work experience in the private sector, opening those doors. You know, the social capital that children get through work experience, through school and in university is huge in terms of future prospects and getting into the workplace. We have to name and tackle prejudice that exists in society, but that also carries into the workplace and is translated into people having to hide their identities or their address or change their address to get a job which they are more and probably overqualified for. So we have a lot of food for thought. Thank you so much, everybody, for my committee members, your patience, particularly Joan, and who waited right to the end, and everybody who contributed this morning. Thank you so much. Thank you.